2 cervical spine extension. Is it okay, Joe? And then the stage 2 for the cervical quadrant is the side flexion to the opposite side, and you apply a compression. Is it okay, Joe? Are you with me?
That's stage 2.
Stage 2. If that test is positive, at this particular stage, you're applying a compression force in side flexion. If that's positive,
What are you compressing on?
you're compressing from the top. If that reproduces pain onto the same side as you bending to the neck to the side, then it's compressing the disc on that side. If the symptoms are on to the opposite side, then it's because of you moving the disc to the opposite side and compressing the nerve. So that side flexion can cause pain to the same side as well as it can cause pain to the opposite side. If it's causing pain to the same side, that's because of the compression of the disc. If it's causing pain to the opposite side, because you're pushing the disc to the opposite side and it's stretching the nerve. You got me? So you need to try to interpret on what kind of movement is reproducing the symptoms. Let's say if that doesn't reproduce pain, sit straight, Joe. So extension of the neck, side flexion of the neck, if that doesn't reproduce symptom, then you add into rotation. So rotation to the opposite side. If that reproduces symptom on the same side, that confirms it's a lesion to the articular facet. Are you with me?
Is this all stage 2?
So stage 1 is cervical spine extension, stage 2 is the compression and side flexion to the same side, and stage 3 is the rotation, in the same position, just rotation. So if the stage 2 reproduces pain, then it confirms the disc or nerve root injury. If stage 3 reproduces the pain, then it confirms the articular facet problem. Does that make sense?
So
Is that-
do you do stage 3, so you go through stage 1 extension, then side flexion, then you apply the rotation whilst in side flexion?
That's correct. Now remember, if stage 1 reproduces pain, you don't go to the next stage.
Yeah.
Whatever be the stage, if the symptoms reproduce, you stop there. You don't progress to the
Same
next
with
stage.
everything.
Yeah. If you progress to the next stage, it will aggravate the symptoms. So it's just that you don't progress to the next stage if the symptoms reproduce at any particular stage.
Is this spur?
If up to stage 2, it's called Sperling test.